Hey, Dr. Madeira, welcome to the show. Thank you for swinging by.
Yeah, thanks for having me on today. Appreciate it.
No, happy to. I'm just a really big fan of this conversation because we just chatted that I love naturopathic doctors. And there are a lot of people, especially in the US, that really don't know what a naturopathic doctor does. Could you give us just sort of a summary of what is it and how's it different from an allopathic doctor, and then a description of what allopathic doctor is?
Sure. Allopathic medicine is what most people call conventional medicine today. It's really shines in areas of emergency medicine and infectious diseases, mostly acute infectious diseases, and surgery. So where it fails drastically and is very expensive is for chronic diseases and lifestyle medicine, which is where naturopathic medicine shines. So if you can marry the best of both worlds, you would have like a catastrophic insurance plan. If you got in a bad car accident or broke your femur, skiing or snowboarding or something, then you would use that emergency medicine to save your life. And then to heal faster, you would go see your naturopathic doctor and take nutritional supplements and herbal medicines so that that bone healed faster. And basically, naturopathic medicine works with using natural substances, lifestyle medicine, nutritional medicine, botanical medicine, counseling, lifestyle counseling, exercise medicine. And historically, it's been around for well over 130 years in the US. And it came from Europe, where present-day Switzerland, Germany, and Austria are now in the Alps and around those areas, and used hydrotherapy, a vegetarian diet, which now we know not everybody should be a vegetarian, and basically using like organ meats and glandulars, herbal medicine, nutritional medicine, and some other natural medicines to essentially stimulate your own body's ability to heal itself, which when your body has what it needs and is living in the right circadian rhythms, as we have a lot of science for now, then it can heal itself better. If you're staying up to 4 a.m. every night and you're eating, all packaged foods and fast food and just never moving and staying sedentary, then you're going to have horrible health, and you probably have diabetes or metabolic syndrome already and have obesity. And we know that metabolic syndrome, well, conventional medicine may just ignore it and consider those people healthy, is one of the biggest epidemics in the United States and all developed countries, as well as obesity. And if you've ever been to Europe and then you've come back to the US after a trip to Europe in the past when we could still travel, you would, if you came to anywhere in the US where most people are unhealthy, like the Midwest or the Deep South, then you would see, or places like Texas, you would see the obesity right in front of your eyes, and how tragic and how that affects people. But anyway, naturopathic medicine can help reverse lifestyle conditions like diabetes, which drastically affect the body, and their chronic inflammatory conditions like metabolic syndrome, things like asthma, autoimmune disease. Those are the kinds of conditions where Western medicine is still failing, and it suppresses the body. It doesn't, if you have diabetes and you need insulin, by all means, use your insulin, but go work with a naturopathic doctor who knows what they're doing, and they specialize in the area of your condition and can help you get well. So that's essentially what I do. I basically practice functional endocrinology. I'm not a MD endocrinologist, so don't confuse me for that. I don't do surgeries on my patients or anything like that. It's all internal medicine within the scope of my practice. And I have a DEA number, so I can prescribe testosterone if needed to men and women. And usually we're using herbs and lifestyle and nutrients and getting them to eat more protein and exercise correctly. And not most people today are undernourished. They're overfed, undernourished. So they're not eating a calorie dense diet. Their macronutrients are all whacked out. Their sleep's all whacked out. Their stress is through the roof. Their stress hormones are completely all over the place. They don't have enough morning energy. Maybe their cortisol spiking at night, so their circadian rhythms are whacking out their cortisol, and then they have more abdominal adiposity, or kind of like love handles. The love handles are more like insulin resistance if you have love handles, and then the fat in front of your belly is more typically more cortisol imbalance. And a lot of people think you have to have high cortisol, but you could have low cortisol awakening response in the morning, and then you could have high cortisol the rest of the day. And that discrepancy could cause fatigue and weight gain, and essentially a resistance in your body to break down fat cells. So when you're in the fight, flight, freeze, your body thinks you're running away from a bear or saber-toothed tiger every day because your life is a stressful mess, then you're going to be storing fat, because fat is like the best, fat's like gold used to be on the stock market, right? Mm-hmm. So fat's the best source of energy, of potential energy that you can store. So we don't store muscle, protein as muscle, we store fat. And then when our ancestors were going through a famine or starvation, they would store more fat so that they could utilize that fat for energy. And anyway, so basically to answer your question, we work with your body, with your health goals, to reverse chronic conditions or put them into remission while helping you live the best, most optimal life possible. I mean, someone may have recovered or been treated for cancer and their cancer may be in remission, but they're still having fatigue or GI issues from the chemotherapies. So then we could support your body to heal those areas that were basically deficient or hit really hard by medications, for an example. Or someone may have chronic fatigue syndrome of unknown cause. All their other doctors have no idea what's going on with them, and they want to figure out what the hell is going on with them. Why do I have no energy every day? And I'm only 25 or 30, and all my other friends are like staying up till 2 a.m. and on the weekends and partying, and I'm like going to bed at 9, So that's a longer explanation, but yeah.
No, I love it because a lot of people don't know what NMDs are. And if you don't mind, could you go through the education process, doctor, of what it takes to be an NMD? Because I don't think a lot of people realize that it's pretty intense.
Yeah, it's very intense. So you have to do at least I had to do all the pre-medical requirements, plus some kind of things that at the time in college seemed like non-important things, like public speaking classes. So you have to do, and I went above and beyond. So I did pre-med plus majored in herbal sciences and psychology and studied botany. So because I knew that I already loved herbal medicine, and I started studying that in 2004, and I didn't start ND school until fall of 2007, and graduated in 2012. So it's a graduate program, it's a doctorate program. So we go through the first 2 years are all the basic sciences that you would do at Allopathic medical school, like in Seattle. If you go to UW Seattle, which is one of the best primary care clinical medical universities in the US, you would study basically the same sciences. And my professors were all PhDs who used to teach at UW Seattle, University of Washington, Seattle. So it was like my anatomy teacher was basically teaching us to know anatomy on the level of a surgeon, it felt like it sometimes. And, very specific, very detailed biochemistry, physiology, gross lab anatomy, dissection lab, all those things. And then you go into second year, you're taking pathology, you do all the ologies, you do all the didactic stuff. So there's usually hands-on class for anatomy lab. Anatomy is huge the first year. So knowing where things are in the body, knowing how they function, why they function, knowing the normal physiology, and then you learn the pathophysiology in year 2. So all kinds of diseases, even things you'll never see, like, chronic heart failure and stuff like that you would only see if you worked in a hospital or were working with that population. So we learn all those things, plus in the last 2 years, all the endocrinology, pulmonology, et cetera, immunology in the first 2 years, everything that you would learn, plus pharmacology. So all the medications that a primary care physician would prescribe, we have to learn those, combined with infectious diseases, and herbal medicine, counseling, taught by PhDs, psychotherapists, and et cetera, et cetera. So, and you're required to do a couple thousands of hours of clinical rotation. So I did a lot of clinical rotations with geriatric populations, pain management, shadow doctors who specialized in men's urology and chronic pain conditions. So those are kind of the areas that I focus in, is men's and women's hormone health and chronic pain and chronic fatigue. And so you need to shadow a certain amount of doctors outside of your regular clinical rotations that you're doing. And we would have clinic Monday through Saturday, potentially. You could have a day where you start out seeing patients at 8:30 or 9 in the morning and finish a class at night at 9:30 at night. So you could have a 12 to 13 hour day easily. And, you know, it's brutal. It's like, complete like military of the mind, where it's a marathon, and a lot of people are used to undergrad. Maybe you're taking 15 or 16 credits max, and especially science majors, and we're taking, you know, 25 to 32 credits in a 12-week trimester. So
holy cow.
They pile it on heavy and deep, and then there's some stuff in there like naturopathic philosophy classes where you have to read books on top of memorizing all the stuff for the science exam. So usually I have a science exam every midterm, and then final, plus papers, plus presentations. So sometimes you would have 2 or 2.5 weeks of final exams, written final exams that are timed, just like you would at any other university. I think a lot of people I've talked to, they're like, "Oh, you're a massage therapist," like in networking in Seattle. And I'm like,
oh my gosh.
You can get a massage therapy degree after taking an exam in 6 months out of college, out of high school, and just need to be an adult, as far as I know, or and take that exam. And I recognize you need to know a certain amount of musculoskeletal anatomy, but it's nothing, you know, it's not even close to.
Yeah, it's not even a comparison. It shouldn't even be brought in the same sentence. Did you keep your cool when somebody asked that?
Yeah, I just kind of was like, no, that's wrong. You know, like,
sure.
I'm not a massage therapist, and you don't want a massage from me.
Right,
So,
right.
So,
Could you tell the people about maybe the boards exam and how that compares to allopathic school?
yeah, I know in allopathic school, you can schedule your board exam whenever you want. It's electronic, and you're in like a booth, usually on a computer. My friends who are MDs, like let's say you're like, oh, I'm too overwhelmed, I'm going to move it back a month. With naturopathic medicine, at least when I took my basic science board exams and clinical board exams, the science board exams are, I think, only once a year or twice a year. So usually February and August. And then if you fail a part of it, so like let's say the cutoff score was 80% and you got 79%, then you have to go back and take the whole thing again 6 months later. So it delays you. Same with clinical boards is about, it's been a while. So it's been almost 10 years since I took them, but clinical boards, depends which state you're going to and what country, but in the US, clinical boards, I believe, are 2.5 days. So 2 full days, so morning and afternoon, with I think an hour and a half lunch break, and then a third morning. And then you have to do a minor surgery exam for Washington State, where I'm licensed, and Montana State, where I'm licensed. And minor surgery is a class that we have for about 8 weeks in the summer, and we sew up pig legs and practice suturing and cauterizing and all those minor surgery things, which you should really do a rotation and more practice before you do that on a person after having only 8 weeks of that, I believe. So basically you have that class, and then 2 years later you take an exam on it, and then you have to read about like suturing and what suture size to use and techniques. And it's probably the worst way to test someone on minor surgery, because it really should be a hands-on test, in my opinion, and optional. Because if you say, hey, I'm never going to do minor surgery, like if I'm going to do minor surgery, I'll take the exam in 5 years from now, but like I'm never going to do minor surgery. And in Seattle, unless I'm in like the middle of nowhere in Montana, no one's going to need suturing from me.
Right.
And they probably could do it just as well themselves. But so that's definitely a weakness for me, but I'm sure I could learn if I had to. I was an EMT before and a ski patrol person before being a naturopathic doctor. So there's a lot to it. Basically, we're in Washington State, Montana State, and Arizona and Oregon, and I believe Hawaii and a couple other states were licensed as primary care physicians. So if you were to get an ND and a midwifery master's degree, you could do everything a family medicine doctor you do. You could deliver babies, you could do, prescribe thyroid medication, antibiotics, antifungals, all those, diabetes medications, metformin, insulin, et cetera. And then you get a DEA number, you pay every 3 years, almost $800 for a DEA number. And you have to, you can't get a DEA number if you're like a convicted felon or something like that. So, because they're controlled substances, and there's a limited amount of controlled substances that you can get as a naturopathic doctor to prescribe, like codeine, cough syrup, and Tylenol 3 and testosterone. It's not, like we can't, and I think unless you're in Oregon, maybe Arizona, I don't know because I'm not licensed there, I can't prescribe opiates. So don't come to me asking for opiates, because even if I could, I'm not going to give them to anyone because they lower testosterone.
With the testing, are you able to give sort of a insight at how the complication of doing the board exam, how does that compare to the MD exam, if that's the appropriate word, or allopathic exam? Are they about the same, or is there a difference?
I think, from my understanding, so they have no nutritional part of their exams, no clinical nutrition. We get a lot of clinical nutrition based on medical research as well, like a whole year and a half or so, or more, maybe, I can't remember, maybe it's 2 years. And you can do clinical nutrition rotations or shadowing doctors or preceptorships with naturopathic doctors who specialize in different types of nutrition. And we're also taught how to read medical research, which may sound obvious, but not everyone knows how to do that. But basically, they don't have any medical nutrition training or testing on it, which we have both. We have botanical medicine classes, which I had an undergrad in botanical medicine, so I was TAing my botanical medicine lab class. So I had, several years, like 4 years almost of botanical medicine training, and I'm doing even more advanced now. And they don't have any of that. They don't know how herbs and medications interact, which is basically an extra class you can do at Vassar University, or at least you could when I was there. They don't know about herbal medicine formulating. A lot, even, so medical error is the third leading cause of death in the US, and some PhDs we even say it's the first before cancer and cardiovascular disease. So it depends on who you read, but a conservative estimate is that it's the third leading cause of death from the British Medical Journal in 2016. You can look up the research. And basically, drug-drug interactions, what the polypharmacy, the allopathic medicine practices, there's no research behind it. And there's a lot of safety precautions that are missed by prescribing practitioners and by pharmacists, who should be cross-checking that to make sure that there's not a drug-drug interaction, which happens a lot with psychiatric medications and can be really, really, deadly and horrible side effects. So we learn about those things, and naturopathic doctors should be checking those things for their patients, even if they didn't prescribe their medication. So before you prescribe, let's say your patient's on warfarin, or your patient's on a anticonvulsant medication for epilepsy, then you need to check that medication against anything you would prescribe, whether it's nutrients or herbal medicines or another prescription. And what's happening in primary care in allopathic medicine is they have about 7 to 15 minutes, if you're lucky, with them.
That's true.
And they're having to see 30 plus patients a day to keep up with the hospital's demands, so the hospital can make a little bit of money off of the primary care in their hospital. And they're in this system where they're not allowed to practice medicine the way that they probably thought they could when they started medical school as an MD student. And that's where things are getting missed or rushed. And that's part of, similar to like surgeons' schedules back in the day where they had to do 12-hour shifts, or back-to-back 8-hour or 12-hour shifts. So like 2 8s back to back, that causing medical error and surgeries. Those are huge, huge problems. And as naturopathic doctors, we have the luxury, you can set up your practice, or if you work for someone else, usually you're sitting a minimum 20 to 30 minutes with every follow-up visit, if not longer. And my first visit is 60 to 90 minutes. I mean, I can do it in 50 or 45 if the person's, really, more simple case. But as mentioned in the beginning, we're talking about chronic, complex conditions. When you do insurance-based medicine through your hospital or the clinic that your insurance or medical provider is covered under, that insurance dictates the amount of time that you can have with your practitioner. That insurance also dictates what you can talk about and for how long. So let's say,
I didn't know. Well, I didn't even know that at all. Insurance tells you how long you look at a patient.
yeah, so there's units of care that insurance dictates that are typically 10 to 15 minutes a unit. So let's say I want to go to my primary care doctor and I have symptoms. Let's just make up something. I have symptoms of headaches, and I'm concerned about my family medical history of heart disease, which is very common, right? I'm just making something up. And I want to talk about both. I have to schedule a separate visit on a separate day for the second item. You only can talk about one thing. This is in the last couple of years, 3 years probably, that insurance has said this. They've also created a lot more basically barriers between you and your doctor. So there's something called pre-authorizations that you have to get for whether it's durable medical equipment, if you have a physical medicine condition like either a bum knee or back pain or neck pain, that durable medical equipment has to be, pre-authorized by your insurance. So that can mean that you have to pay a staff member 2 hours to be on hold for an hour and a half to talk to someone for 20 to 30 minutes to get the authorization so that your patient can have their insurance cover that durable medical equipment. So insurance is essentially the very expensive middleman that takes typically everything in medicine and multiplies the cost 10 times, 10x. That goes for your lab test, that goes for everything. And then they're also creating the price of your medication. So when you pick up your medication at your local Rite Aid or Walgreens pharmacy, the price that you're paying is the agreed upon price that insurance and the pharmaceutical companies have come together and said, okay, this is the price of this medication with this insurance. And then you usually get an estimate of benefits, an EOB invoice that says your insurance was billed for this for X amount of zeros behind a number. And this is how much your insurance was billed. And this is how much, and then you get a bill 2 months later, a month later, it says this is how much this costs. That urgent care visit was $175. You have to pay your $20 copay. So a lot of the costs are hidden, and people don't understand that when they're paying for a copay, they're paying for their medications, they're paying for their premiums for their insurance, and then they're paying for all these extras on top of that, that they don't read their insurance plans. Typically in cities like Seattle, they're very corporate. They're getting their insurance through their employer. They don't even really remember what they signed up for. They may know their deductible, they may not. And they don't know what's covered. They don't know what they basically signed up to pay for. They're still paying for that. They got a little bit of a wholesale or like group discount through the corporation where they're getting a little bit less premium that they're paying per month for pretty good insurance. If they were to pay private, it would be probably $150 to $300 more per month, depending on their age group. So since insurance is essentially you're paying somebody to be have a little bit of buy-in financially into your sick care. They're
Sure.
great for, you break that femur skiing or snowboarding, and you hit a tree and you have a head injury. for acute care. They're not great for chronic care. They're not great for recovering from that fracture or that head injury. They're going to give you medications for chronic conditions that are band-aids or suppressive. So when I had a concussion, I went to my neurologist at a hospital I won't say the name of in Seattle. And the neurologist said to me, my MD neurologist said point blank, it would actually been better if you had actually fractured your skull. From the research, we can give you more muscle relaxers and switch you to another one that's experimental off-label use for concussions that an MD from Europe gave a presentation on. And I was like, oh, great. So I can sleep 12 hours every day and feel like a zombie every morning, which already isn't really working well for me in the winter in Seattle when it's dark and gray out. And they had nothing. And they're great if you need brain surgery, you know, neurosurgeons and all that stuff. Miraculous, amazing what we can do now. They're great if you need to get cancer taken out of your body, and then some cancer treatments that have there's a lot of developments that's been happening in cancer, even though in the last 50 plus years, there's been no appreciable benefit that has moved the needle drastically, maybe more than 1% in preventing cancer deaths. So that's a whole other conversation. It's a multi-trillion-dollar industry there. So basically, allopathy is really good at some key things. And as a past EMT, I would never tell somebody not to go to the hospital during a medical emergency. I think naturopathic medicine is what has helped me. I know it's what's helped me stay healthy and get healthy after having chronic fatigue when I was in high school and college. And I think there's a time and a place for medications. And I think most medications, unless they're hormone replacement therapy for the right reasons, and you know that person definitely needs it, I think that a lot of medications that people know about that may be listening to this should only be used for a short period of time, 6 to 12 months, maybe 2 years, while you're working on underlying root causes. And there's definitely times when people can't afford the kind of medicine that I do. There's times when people need to take longer and spread that out longer. But if you're on like a statin medication or SSRI and you have low libido and you have low testosterone and fatigue, you need to figure out why you were put on that medication. And if you can lower the dose safely, if you can work with a prescribing doctor who prescribed it and don't go off it abruptly, that's dangerous, especially for antidepressants. And you need to work with someone in conjunction with them in an integrated way to figure out like genetically what, you know, genetic things you need to replace through nutrients, through your exercise, your diet, your sleep, so that you can optimize your brain health, your hormone health, so you don't have to be dependent on medications, because the average American over age 50, 55 is on 4+ prescription medications all the time.
Yeah,
and
I heard about that. That's crazy.
There's no evidence to show that that's effective. There's no long-term outcomes evidence has been horrible for statin medications. Statin medications are not preventing heart attack and strokes like they thought they would. Their cholesterol is not the devil. Cholesterol is the downstream effect of chronic inflammation happening in the body, in the gut, in the cardiovascular system, in the brain. And it's coming from somewhere else. And then it's showing up as, oh, you have high LDL. Well, if you have really low LDL and you're on a statin medication that's below 55 on your blood test and your regular cholesterol panel, on your lipid panel, you have higher chances of cancer. So what's the risk benefit analysis here? You know, if you're taking a statin medication just because your doctor said you have to take it and your dad and your uncle all died of heart attacks at 55, then you gotta look at, well, what are you eating? How are you moving? Are you moving? Can you move? Are you in chronic pain and that's why you can't move? Have you gained a lot of weight since you were, you know, young and healthy? And, you know, a lot of people normalize this kind of chronic fatigue, chronic pain. You know, I'm just getting old. Everybody in my family has joint pains after age 45. Well, everyone in your family is sick, you know, and everyone you're around is sick pretty much, unless you're like the, you know, 0.111%. Most people in North America and in developed countries are very sick. And in the US, we are the sickest developed country who spends the most money on sick care. It's not healthcare, that's false advertising. Insurance is not healthcare. Your hospital is not healthcare. Your medical doctor, your nurse practitioner, unless they went to functional medicine and got an IFM certification, are not healthcare. They're all sick care. They're not focused on wellness. They are probably awesome people and probably amazing practitioners, and they got very good education and they have amazing technology and amazing tools at their disposal. However, their hands are tied, like I already mentioned, with insurance. So, when I go to do something and I order a direct lab with direct lab pricing at wholesale lab values, you are getting a huge discount over a course of 6 to 12 months. You usually want to test hormones every, 3 to 4 months. Then you're getting hundreds of dollars in savings there. Whereas if your insurance has, $5,000 or $4,000 to $7,500 deductible, they're not going to pay for 80% of those lab tests until you hit that deductible. And then they're going to ask for the medical necessity of, why are you checking your hormones, Mr. and Mrs. So-and-so, every 90 days? What's wrong with you? Do you have a brain tumor? Do you have a adrenal gland tumor? And they're looking for extreme medical pathology for medical necessity. They don't see chronic fatigue as medical necessity. They don't see like subclinical hypogonadism or subclinical perimenopause or painful menses. The conventional approach to painful menses is you just give them synthetic birth control or synthetic hormones like an IUD and stop their period, and voila, magic, they're all better, right, for now. And then 5 to 10 years from now, they want to have kids maybe, and they have a baby, they're not able to breastfeed, they're having all kinds of complications from, as Dr. Jolene Brighton, who's an ND from Portland, Oregon, wrote a book about birth control pill syndrome, so post-birth control pill syndrome. And you can check out that book. So that happens all the time. And what happens for men and women who have symptoms of low testosterone, they may have like a subclinical depression. They get put on an SSRI or an SNRI, like Wellbutrin, which is, maybe they need that for a year, like I said before, but maybe they need that and they need therapy. Maybe they need to work on a trauma they had in their teens or younger years that they barely remember and heal that. Or maybe they actually really need hormones, and just getting them on testosterone and bam, their depression's gone. Or, women need testosterone too. And they probably don't need birth control for women. They probably don't need antidepressants, which actually, if you look at the research of antidepressants, there's a lot of fraud from the pharmaceutical companies around modern psychiatric pharmacology. And if you want evidence-based medicine, it's going to be lacking in that area, in that industry. It's basically a huge money like cash cow for them. And a lot of these psychiatric medications can cause homicide, can cause suicide. It's on the prescription. Like if you pick up your prescription and you actually read the papers that the pharmacist put together, there's like 12 pages, right? Like I took Wellbutrin after a head injury for a little bit, and because I needed it. And if you read it, it's like side effects, suicide. Well, that's what we're trying to prevent right now. So that could go really south. And then it keeps going. And Dr. Kelly Brogan talks about this. She's an MD who doesn't use psychiatric medications, psychiatrist up in New York City. So essentially, in medicine, every type of doctor, whether you're a naturopathic doctor, a chiropractic doctor, you're a psychiatrist, an MD, primary care doctor, a surgeon, we all take our own oaths in public after we graduate that say we're not going to do any harm. We're going to avoid harm as much as possible with our treatment. So if there's surgery or there's an herbal medication that can prevent, that could actually have a similar treatment outcome. For example, in men's health, if a male has varicocele, which are basically varicosities in the veins, in the blood vessels, leaving the testes, and it looks
Right.
kind of like a bag of worms. If they have varicocele, they can take a concentrated herbal medicine that has the same research outcomes as a surgery for the same condition. So when you're thinking
But
first
doctor,
female
what,
harm,
is the research quality the same? Because that would be somebody arguing like, well, with the medicine, it's in a control, and then herbal. So it looks like you already have an answer already for that.
yeah, I mean, I could share the research. I don't have it right now,
Oh
but
no, no, I'm just asking. Just
there's definitely research to show that they both had similar outcomes for the research group's surgery compared to the herbal medicine extract. And that's an herbal medicine horse chestnut extract used for varicose veins for a
okay.
long time. It's just one example, and there's obviously other things you can do with diet and nutrition, obviously decreasing inflammation or figuring out where inflammation is coming from. And a lot of people, I think, coming from an allopathic point of view, think of like using ibuprofen when you have an injury, or, I've heard people say things like, who are marketing supplements, because anyone who's marketing something who has a conflict of interest by marketing that product, like for example, turmeric, which has a ton of research for an herb,
Right.
turmeric and cannabis are the two most researched plants basically in the world that up to this time in history, and been used for thousands of years, both of them in India and other places. And there's tons of benefits. I think both have a lot of uses medicinally. And, I've heard people say after you work out, you have some inflammation in your muscles and in your joints, and you can put turmeric powder in your smoothie. And it's like, no, like you need that inflammation. That inflammation's part of the benefit of working out and part of what's happening to when you're, growing muscle and muscles being reconfigured and things like that. So I think a lot of what happens is what we call green allopathy, is where you have someone take like an herbal medicine course over a weekend, or they go and get some functional medicine training, but their philosophy is still in allopathy. And that could be really helpful for someone. That could also be harmful, where every time you see inflammation, you're trying to put out that fire. But the question should be not how to deal with this, but why does this patient have inflammation in their blood, or why do they have inflammation in their colon? Is this autoimmune condition, or what are the triggers causing this? Is it infectious? Is it, are there foods that are making this worse, or what's really going on here? Is this person have physical pain because they have a neurological condition where they can't walk and they fall down all the time, and then maybe they need to go see a functional neurologist and work on that. So when you're looking at finding the root cause, it's about asking why, and then figuring out what the plan is, not looking at like one biochemical mechanism, like, oh, well, let's give them an herbal medicine that's a COX-2 inhibitor, just like NSAIDs and ibuprofen, et cetera, which have those NSAID medications can lower testosterone and cause other problems for the gut. And there's all kinds of people overdosing on those every year and dying. So a side note, a lot of people think over-the-counter medications are like vitamins for some reason, like they're just as safe as because they're over-the-counter, which isn't the case, which any pharmacist would tell you that.
Okay. And I do like your detailed answers, because there's so many more questions I want to ask, and I want to have a 4-hour interview. That's not going to happen. But the one thing you've been mentioning a lot are hormones. Now, as a guy, because I'm still learning about health, is that usually when you say hormones, you think it's a female related thing, but I'm starting to realize it's a male thing. And can you give us a little more insight about that?
Yeah. So men, you want to optimize your testosterone to your estrogen ratio, your testosterone to your dihydrotestosterone ratio, and look at free and total testosterone levels in your blood. Get it tested, non-fasting, abstain from exercise for 24 hours, and get it done before 10 a.m. because testosterone is higher in the morning. And if it's low or low normal on the range, the total testosterone range is pretty broad. It's gone down, which is a whole other conversation we can touch on in a second. But essentially, you want to be at like the 80 to 100th percentile, like the last 20% of that normal range or higher. And if you're not, if you're less than half, then something's going on, and you need to figure out why that's happening and work with someone like me or my colleagues that know how to look at these things. And most people don't know how to look at male hormones because, like you said, it's like, oh, you're in normal range, you're good, dude. You're not even 50. Andropause is like male menopause, and this doesn't happen until you're 49 or 50 plus, which is partially true because naturally your testosterone is going to decrease total testosterone 1% every year after age 30, and free testosterone about 2%. However, most guys that I'm talking to now under age 35, 20 to 35, and even younger have very low testosterone. You know, I'm talking like less than 400. And after 400 total testosterone.
That's me.
Yeah.
That's me.
Yeah.
It's stress.
So, it's stress. It's not sleeping enough because, like, you know, if you're an entrepreneur like we are, sleep is like the first thing to go. You know, your ability to nurture yourself and say, hey, you know, I need to take 3 hours off today. I need to go to the gym for an hour, hour and a half. I need to meditate for half an hour, and I need to run an errand and go buy some healthy food and cook it up. And then I need to go to bed before 11 o'clock or 10 o'clock if you're an early morning person, and get at least 7.5 hours of sleep or 7 hours of sleep. So you're making enough testosterone in that hour and a half of REM sleep. That's when you're making, and like right around that time, that's when you're making T. So if you're skipping out on sleep, you're probably going to have low androgens. And that andropause for guys, like I mentioned, can happen at any age. And then women also need testosterone. So usually you think of female hormones, you think of estrogen first, which is true. And after menopause, low estrogen and osteoporosis. And then you think about maybe progesterone if you're keen on that. But they need a little bit of testosterone too, just like men need a little bit of estrogen. Because if you don't have enough estrogen as a guy, you can have osteoporosis at a younger age. You can have sexual dysfunction, mood conditions. So a lot of these things are nuanced that, you know, most likely, unless you see as a female, like an OBGYN who is also doing functional medicine or anti-aging hormone replacement therapy medicine, they're probably not going to go into this nuance with you. They're probably not going to do urine and blood testing, which I think every male and female, if they can afford it, should get both. Like a Dutch test, which is a lot cheaper if you order it through a doctor like me, but you can pay more if you have the money and just order it yourself. It's like reading Greek if you don't know how to interpret that test. So you're going to have to hire someone to interpret it for you. And even doctors have to get training to learn how to interpret it. That's why I say that, not to demean anybody's intelligence, but the blood tests are also crucial because then you have, okay, the blood, this is what you're finding at that time of day when you test it in your blood. And then this is the urine metabolite. So this is probably what the receptors are utilizing. You know, this is the bioavailable hormones that your hormone receptors are utilizing. And I hope in the future in science, we'll have tests that are specific to androgen, estrogen, and progesterone receptors. Right now, the tests that we have for that, as far as I know, are for like estrogen and progesterone positive breast cancers in oncology. But we don't have tests for like the average guy to say like, okay, your testosterone's 800 total, it's 15 or 25 or 30, which is awesome, free testosterone, but your androgen receptors are like only at 20% capacity. So that's why you actually feel like crap. And let's see what we can do to work on that. Or looking at dihydrotestosterone, which has been demonized for men because they thought that it caused prostate cancer, but actually having optimal levels of dihydrotestosterone optimizes your chances of having a healthy prostate, healthy brain, healthy heart, because your androgen receptors love DHT, dihydrotestosterone. And you're going to have lower libido if you don't have enough. You're going to have increased chance of prostate diseases, so enlarged prostate or prostate cancer. And it's actually chronic inflammation, insulin resistance, and elevated toxic estrogen metabolites that you can look for that cause prostate cancer, not dehydrotestosterone. You do need to have testosterone, and dehydrotestosterone doesn't convert to estrogen like total testosterone does. So there's a lot. Basically, before I like keep going on my spiel, I just want to say that there's a lot. If you're listening to this and you're like, whoa, like we just went into outer space.
Yeah, it's
and
overwhelming sometimes.
Yeah, Dr. Sam just took off, and like he's 3,000, 300,000 miles out there going to Pluto without me, talking about hormones, and I don't get it. Just schedule a free consult with me, and we can see like if you actually need to get your hormones optimized, or just go to my website, apollohealthclinic.com, and you can check out some free resources there. You can download for free. I also have my own podcast with 61 published episodes, so you can just look at one that looks like it calls to you and you want to learn more about it. You can check those out.
And you also do telehealth, because that's getting more popular because of COVID, right?
Yeah, so I started doing telehealth basically before I started doing my clinic for other doctors in 2013. And then I started my clinic in downtown Seattle, about a 20-minute walk north of Pike Market. If anyone knows Seattle, it's a pretty famous area. And pretty soon, with all the construction with Amazon and the developments going on in downtown that happened from 2015 onwards, after I started my clinic, a lot of patients just they work a lot. They don't want to drive to downtown. They don't want to take an Uber there. And I surveyed my patients over and over again. Most of them were like, I would be happy with a phone or video consult. And I just said, hey, let's just talk in person once a year and keep going with your treatment. And we, both of us can stay home and save on gas and parking fees and
time.
And time. Yeah. Cause time is, a lot of people focus on not having enough money, but time is money's a renewable resource. Time is not. So I tell my personal story often where I had chronic fatigue and chronic infections and Lyme co-infections and reactivated mono and all that hellish stuff, and had all kinds of symptoms, headaches and gut problems and stuff from late 90s to after medical school even. And a lot of naturopathic doctors miss that root cause diagnosis. That cost me a lot of money, but it cost me 14 years of my life, where I would pay probably over $1 million to go back in time, find the doctor that I had found in 2013 and doctors after that, and do it differently. But obviously our experiences are learning experiences so that we can help other people. And that's why I see that as an asset now. However, I share that because when you pay more, maybe in 6 months, for root cause diagnosis and treatment, you're going to get better faster. And then the next 6 to 12 months, or the next 12 months after that first year, you're going to pay less money every year after that, which is the opposite of what most Americans are doing, where they're spending 15 to 20 grand every year on their sick care, and they're getting sicker and sicker every year. So you would be going the opposite way, and you could actually be getting your cellular health could be getting younger and healthier and less inflamed and less fatigued and less pain, or less of the symptoms, whatever your symptoms are, fill in the blank. So so I do telehealth. I've been doing it for a while. And then when COVID hit last March, all the tech companies in Seattle sent everybody home, and I kept going to work every Wednesday, one day a week as always. And then I was like, I think we're going to call this. And then mid-March, I hightailed it to Northwest Montana and got out of the Pacific Northwest, because it was getting a little weird. I saw some videos of what was happening in China, and I was like, if that happens here, I don't want to be anywhere near that. So
sure.
So I got out of there, got to Montana and did telehealth from there, and I have a clinic there too. But some people love the in-person contact, and they're like, I got to see you in person. I need somebody that I can talk to and that can look at what's going on with me. Maybe they have a skin condition, or they need an abdominal exam, or they need an IV, or they need actual like hands-on procedure, like they need an injection treatment like prolotherapy or something. Like, yeah, you can't do that through telehealth, obviously. So I recognize that, but I do appreciate technology for telehealth, because a lot of people are tired of running around big cities in traffic for doctor's appointments that maybe they don't trust you yet. They don't trust the doctor yet. They don't know if you can actually help them. And it's just saving, like you said, that time that's so valuable. And maybe they need to be at home for work, or their kids are home with them now.
Oh yeah, sure, sure. I remember when you were talking about hormones and how you had your chronic reason. It's probably one of the reasons why you became a naturopathic doctor. You did mention gut health, so that, in my opinion, well, I'm still learning as well. That relates to mitochondria. Is that something you work with a lot? And do you see issues in your patients regarding gut, and also mitochondria health?
Yeah, definitely. Yeah. So I was actually this morning just reading a research paper about type 2 diabetes, which is very common. Millions of people with type 2 diabetes in the US. And it causes low testosterone, but it's a chronic inflammation condition. And what happens to the mitochondria from that chronic inflammation is testosterone works with the mitochondria. I won't get into the details of that, but um, if you have chronic inflammation, you're going to have less testosterone. If you have diabetes, you're going to have less testosterone. The combination damages mitochondria and damages the ability of testosterone to work with mitochondria. So cellular health is very important for hormone synthesis. The receptor for testosterone is inside the cell nucleus. There's like an outside, basically, portal that pulls in the testosterone or dehydrotestosterone into the cell nucleus, and then it goes out to other organelles of the cell and then builds in the Leydig cells of the testes and builds your testosterone. 95%, roughly 95% to 98% is made in the Leydig cells in the testes, and the rest is made in the adrenal gland. So castration level of testosterone total T is 55 nanograms per deciliter. So if you're at like 150, you're like, you got to get that level up to basically save your life. But the inflammation destroys mitochondria, infections destroy mitochondria, chemicals destroy mitochondria. So mitochondrial illness is basically, with chronic inflammation, the root a lot of chronic fatigue syndrome. You just got to figure out what that insult is to the mitochondria. So, why is the mitochondria not making enough ATP? Like one thing that I saw a lot of about 3 years ago is ketogenic diets, which are still pretty popular. Everybody and their mom and uncle were coming in on a ketogenic diet. And there's actually genetic testing you can do to see if you should do a ketogenic diet and if it's actually beneficial for you. But they didn't know, and some of them were doing it very wrong. And they had, the keto breath, and they had lipids through the roof, like 350 total cholesterol, and felt horrible. And you do organic acid urine tests and you come back with a test result, and it's like, hey, you are not getting any ATP from fatty acids. Oh, okay. Oh, let's do another gut test. You also don't break down fat. You're pooping out all your fat, so your gallbladder is not firing to release bile salts and bile into your intestines to break up and emulsify fat. So you're crapping them all out. So you basically aren't getting any energy from your food because you're eating mostly fat, and your body's not able to get it either through digestion or both digestion and at the mitochondrial level. So there's things you can do to help that, and then obviously getting off that diet until you fix those things. If you do the genetic test and it's like, oh yeah, Joe Smith does really well on keto, it's actually, we got to get that vagus nerve firing on the gallbladder and work on vagal tone and gut health and enteric nervous system. And they're just like
Is that a blood test to test whether or not keto is good for you, or what kind of test is that?
The genetic test that I use is through the DNA company. You can order it yourself. If you're a patient, I get my patients 10% off, which saves them a bit of money. And you can test your genetics to see, like, if you do okay with carbs, if you are like prone to be a snacker, if you do better with, if you gain weight on carbs, or if you do gain weight on fats. And if you, let's say you gain weight on carbs, but you don't gain weight on fats, then maybe a paleo ketogenic diet is better for you. And, there's medically, from the science, like epilepsy does better on keto, or brain conditions. concussions, neurological conditions are better to do keto. So.
Oh, I did surfing and I got introduced what a concussion was. So
Oh man.
I've been eating my fat, cod liver. I get, I forgot, oh man, Green Pastures, they do grass-fed, grass-finished cod liver, cod oil, including the butter
Nice.
fat. So yeah.
Oh
Yeah,
yeah.
I'm still surfing. I'm doing it with a helmet now. I'm the only one in the ocean doing it. I gotta, protect my brain. That's for sure.
Yeah. Yeah. I mean, head injuries. So head injuries are a big cause of low hormones for men and women, and very, very frequently miss. A lot of, I can probably count one doctor that's asked or treated head injuries that I've worked with, maybe two. And since 1999, I've seen a lot of naturopathic doctors, a lot of doctors, period. So, I love naturopathic medicine. I love my professors. I love Bastyr University. I think the medicine is awesome. However, you can find a doctor that's really good at one thing. Just like me, I have my blind spots. They have their blind spots. They may not ask about it. So it's very important that you share that information with people. And, if you had, and the other thing is like, the thing with concussions, especially as guys, especially when you get them when you're younger, like you fall out of a tree and hit your head, or you're fighting with your brothers or your friends and you get knocked in the head and your bell rung, you're usually not like, oh man, I need to go talk to someone about this, I need to go talk to a doctor and see what they can do for my brain. It's like, let's keep going,
Right. Yeah.
suck it up,
Yeah.
keep going, or no big deal, I didn't have any symptoms that really mattered. But I mean, that can cause other problems later on. So I just mention it because usually with concussions, especially with women too, but especially with guys, it's like, yeah, I don't remember anything, like maybe one from this thing, but nothing else. And then after you kind of get to know that person more, you're like, wait a minute, like you were doing all these things, like you rode BMX or you were snowboarding and every week you hit your head, or you played football in high school and you probably had multiple minor head injuries that whole time. So I think that it's kind of human nature today, especially a lot of people normalize everything. Like I've heard guys and women say it's all in my head. Maybe I'm just making this up and it's not a big deal. And maybe it is all lifestyle, and maybe you need to sleep more. Maybe you need to stop working out so much and let your adrenals recover and stop doing like HIIT training and walk and lift weights and get an Oura ring and work on like improving your health that way. But if you're still not getting traction after 3 to 6 months, most likely it's not all in your head, and there needs to be something done, and you need to schedule a doctor's appointment and stop procrastinating and minimizing your health problems, because it could be something very serious, or it could be something that's, could become very serious if you let it fester for 5-10 years. And then later on, it's like, whoa, now it's really expensive to take care of,
Yeah, it's
so
true. It's very true.
you can save a lot of money by just taking care of it earlier. And I think a lot of people are like concerned. We're not conditioned, like no one's conditioned to take care of themselves. Like no one's conditioned or rewarded in our society, anywhere for that matter, to sleep 8 hours a night, to eat a healthy diet, to exercise. I mean, maybe exercise if you have like an athletic community or friend group, like, hey, let's go run a marathon, which is probably not great for your health or your hormones. But no one's giving you high fives at work or like a fist pump, for a Zoom meeting now, Monday morning after like saying like, yeah, I went to bed at 10 a.m. every night this week and got 8 hours of sleep and I feel like $1 million. Like they'll be like, that's great. Right. That's great, dude. Like whatever.
And Dr. Sam, because I have probably maybe 10 more minutes left with you. I want to, because your other specialty, and I could tell the passion about it, is herbal medicine. Could you, like the next 5 minutes or so, is talk about what do people get wrong about herbal medicine, and what, throw some case studies. What have you seen work on people that they did not even believe that it worked on them?
Yeah, that's a good question. So recently I had a case where a guy was, I can't like share his exact
Sure,
age,
yeah,
but he
just in
was
general.
between 40 and 50, worked out probably 6 days a week, 2 hours a day, and afternoon fatigue, feeling like he was missing kind of the edge with work and motivation. So not like clinical chronic fatigue syndrome, but enough so he noticed as a very active, healthy person. Had been put on a statin medication, which I told him he needed to just get off of that and take some other things like fish oils, like you mentioned, and eat healthier fats and um, work on the diet. And then decrease the exercise, because an hour, up to an hour of that 2 hours was cardio. So chronic cardio is going to increase cortisol, decrease testosterone. And he didn't have like, he wasn't like severely low testosterone. I think it was below 500, around like 425 or something total T, and low free testosterone. So we got him off of that, got him on some nutrients and herbal medicines like ashwagandha complex from Medeira and boron to increase free testosterone and work on the sex hormone binding globulin being too high. Got him off the statin medication onto a couple of things, like usually it's like citrus bergamot extract and fish oil. And his testosterone came up over, I think it was about 300, 200, 300 points
Wow.
in
Over what,
about
like 6 weeks or a quarter?
it's about 6 to 7 weeks. Yeah, almost
That's
8 weeks.
nice. I'm jealous.
So, yeah, yeah. So I don't recommend someone just go off of their medication. I mean, I said let's do this and retest. Have your primary care doctor retest, and you can tell them that you decided to go off of this. If you are taking a statin medication, you need to take CoQ10, which CoQ10, if you're getting quality CoQ10 from like a quality nutraceutical company like Metagenics, and you're taking a good therapeutic dose, 200 to 400 milligrams a day, that gets expensive. So that statin medication, while it could be covered by insurance, that quality CoQ10 is not the Rite Aid CoQ10 that you buy next to the pharmacy shelf. And just getting off the statin could save you a lot of money on CoQ10 and save your statin's a mitochondrial toxin. So it works on the electron transport chain and the cytochromes there. And that's why CoQ10 is part of that ETC and making ATP. So there's also genetic testing you can do in your blood or saliva to see if you actually need to be on a water soluble instead of fat soluble statin, or if you're going to get a myopathy from like simvastatin, which is a very commonly prescribed statin medication that's fat soluble. So it gets exciting. Like, it depends how far down the rabbit hole you want to go, but with nutrients, changing exercise, getting off of medication, and some key herbal medicines, Korean ginseng, licorice root, skullcap, and ashwagandha are in that herbal medicine formula. It's a tablet by Medeira, which is pharmaceutical grade herbal medicine company out of Australia, and very concentrated. So you can't get that from like a tincture. A tincture is a 1 to 5 extract, alcohol extract. So you can't like make this at home. It's something that's made in a
Right.
manufacturing plant. So, like 7 or 10 to 1 ratios we're talking about instead of a 1 to 5 ratio, which is a huge, huge difference. So he, I think he's probably due for another lab test and check in on things. So should probably check in on him, but he's like really happy. He was like, oh, I don't need to go on like any medication. Like, this is awesome, and just a couple of tweaks here and there. And, there's some other things you can do for mitochondria, getting red light therapy or getting out in the sun if you live in a sunny place like Florida can help with mitochondria. And I mean, it doesn't have to be complicated. Although the lab testing, a lot of this like genetics I'm talking about, like all that may be very technical and you need someone to interpret it. But oftentimes the actual what you have to do is like, okay, I got to take these things. I got to sleep a little bit more. If I'm tired and I get 5 hours of sleep one night because I had to work late, I'm not going to go lift and try to hit like my 1 rep max record that day in the gym. I'm going to go for like a 3-mile walk, So and maybe like do some yoga at home or body weight exercise. So I think like these adjustments, while they may be foreign to people, like, wait a minute, like I'm not working out 6 days a week anymore. I'm only doing 4 or 5. Like, this is weird. I got to eat more protein. I thought protein caused cancer, and I thought beef caused cancer and is evil. Okay, now I'm going to eat a steak twice a day and take some liver,
Right. Yeah.
cod liver oil and beef liver capsules or something. Like that all just may be like wacky wild to people, but it's very simple. We're trying to decrease your toxic load. I've also done lab tests on people where it's like, whoa, what's going on? Like, you live next to like this big agra monocropping machine over here, and you're breathing in all these chemicals, and you're microwaving things in plastic and drinking water out of plastic. Like, let's just get rid of all of that and get you a good quality air filter, and don't open your windows when they're doing their harvesting. So a lot of it can be, okay, let's create a healthier home. Let's decrease the chemical exposure and change up the lifestyle. And then people are like, wow, I feel a lot better. I had one other case study, patient, all they did really, because they couldn't afford herbs and supplements, is I asked them we got their testosterone checked. It was around 350 total testosterone, which is very low. Below 400, you're getting damage to the penis and venous leakage in the penis, which is bad. You could permanently have erectile dysfunction if that keeps going on. So,
well, what's the leakage, like urine, like after you pee, a bladder control, or what kind of leakage?
No, like inside the blood vessels.
Oh, I see. Okay.
Instead of the penis being able to like lock in blood and hold it, it kind of like leaks out.
Oh, I see. Okay.
Yeah.
Okay.
So the vascular system has some issues with basically the endothelial cell walls and endothelial function, and it's vascular disease. So vascular disease is caused by diabetes or insulin resistance, metabolic syndrome, that chronic inflammation, and that causes cardiovascular disease and heart disease. So if you have erectile dysfunction, I usually tell people that's really bad, because it could be adrenal stuff, hypothalamus, pituitary, adrenal, like you're just stressed, like you said, or like if you're never getting an erection, you can't get an erection even when you're having sex, or if you watch porn or something, or whenever you're turned on, essentially. If you have no morning erections and you have to use Viagra and maybe that doesn't even work or something like that, then you probably have venous leakage, and then you could have coronary artery disease in your heart, or plaques building up in your blood vessels going to your brain or in your brain. And that's a huge red flag. So I usually say, like, my acronym for erectile dysfunction, ED, can equal early death. And that's preventable if you get on a treatment plan. And maybe you do need to be on a statin for a year or two while you're cleaning up your lifestyle, because us guys, we're a little bit slower than women on this kind of stuff. Like,
yeah, that we are.
Eating the fried chicken and McDonald's hamburgers and like the fast food and the cheap food, or the microwavables and all that plastic and stuff. It's just, guys are conditioned to be a little bit more stubborn, a little bit more like
macho is the ego.
Yeah, like this kind of like shell of machoism, which is, I think that's great. I think mental toughness is definitely something that needs to be instilled, especially in the younger generations. Like, keep going, suck it up. Great for your career, great for sports, great for the military. We don't want people like not sucking it up going to battle. But when you are talking about your own health and you have symptoms where your body's screaming at you and saying, wake the hell up, pay attention to me, take care of me, I feel like crap, you're killing me. Like, there's a great bit by a comedian, he talks about this, and he's like, just like, give me some water, damn it. Like, I can't function on Coke and Pepsi all day. Like, I don't want soda anymore. Like, I don't want French fries. Like, I want real freaking food. And it's like, your body's just asking for what it needs so it can be healthy. And, you could just listen to this podcast and be like, all right, like, I'm not going to eat fast food anymore. Like, I'm not eating anything that's in a packaged food box. Like, if it doesn't rot and if it didn't moo or make a an animal noise, like I'm not eating it. If it doesn't go bad, then it's not real food. And yeah, it's going to cost a little bit more money, but it costs a lot of money being in a hospital for a week.
Yeah, pay up front so you don't have to pay at the end. Because with me living in LA, I have a naturopath I see in Phoenix. And I think would it be doing a drive? It's 80 degrees in Phoenix, so it's not that bad. But I have less than 5 minutes with you because I know you have to get back to your cases. So I have 2 questions. Keep them short and simple. My first question is, if I gave you $100 million and you had to allocate it to research, what would it be?
Neuroendocrine research. So I'd research more about the brain and the nervous system, knowing the brain, as well as improving the endocrine system for probably men, because things like Alzheimer's and Parkinson's are on the rise, but also with that, looking at what hormones, whether it's progesterone or testosterone, estrogen, how they influence the brain in a lot more detail with animal studies and then human studies, because that's something that when you do the research, you're like, oh, testosterone might help the brain, but it's not going to like prevent by itself neurodegenerative disease. So that's my answer to number 1.
Okay, and then the last question, and really, man, thank you so much for taking the time to talk to me. But my last question is, if you're allowed to send one tweet to everybody in the world, what would it be?
Whoa, that's hard because you're with Twitter.
I know you're limited.
And as you experience, I'm a little loquacious. I think my tweet would be something along the lines, and I may have to have someone help me write this sentence, but something along the lines of, you can heal yourself. It's possible. And it's not all in your head. Like, you're not going crazy because you feel this way.
All right. Well, Dr. Sam Madeira, thank you so much for taking the time, and thank you again.
Thank you. Yeah, I appreciate it. It was fun.